Okay, today's class is on the upper respiratory tract. So we'll look into respiratory system. So what is the function of the respiratory system if you look? Respiratory system is mainly involved in providing oxygen and removing carbon dioxide from the blood. Some part of the system is also involved in smell, like if you see a nasal cavity, and speech, if you see a larynx. Okay, then so these are the like main the function of the respiratory system is to provide the oxygen rich blood and remove the carbon dioxide blood from the blood. So then in this the main other function is also there. If you look the nasal cavity, the function is smell, and if you look the larynx, that is the voice production. The phonation is done by it. Then, if we look into the respiratory system, it is divided into two parts. One is called as a conducting part, and one more is called as a respiratory part. So, conducting part, what do you mean by conducting part? The conducting part means which will provide humidity and temperature to inhaled air. You inhale the air. For that air, the humidity and the temperature to the inhaled air is done by the conducting part. Then the respiratory part is the one where the gaseous exchange take place. So the respiratory part includes the alveoli. In the lungs, there are presence of alveoli. Only in the alveoli you see the gaseous exchange. All other part are involved in the conducting part of the respiratory system. So if I tell you the parts of the respiratory system, it includes nose, nasal cavity, paranasal sinus, pharynx, larynx, trachea, bronchi, and the small bronchioles, lungs, and which contain alveoli. So, if you look, the respiratory system parts are nose, nasal cavity, paranasal sinuses, pharynx, larynx, trachea, bronchi, and their small bronchus, lungs, which contain alveoli. So remember, alveoli is only involved in the respiratory part because it is involved in the gaseous exchange. Exchange of gases takes place in the alveoli of the lung. So look into the figure here. You can see in the figure the parts of the respiratory system. So it consists of nasal cavity, then comes the pharynx, larynx. Larynx will continue further as the trachea. The trachea will bifurcate forming the right and left bronchus. Then you can see here the lung which consists of alveoli. So these are all the parts of the respiratory system. So you have to know what are the parts of the respiratory system or what all it includes. First, we look into the nose. So, what does the nose does? So, you know, only the externally visible part of the respiratory system, the only the visible part of the respiratory system you see, that is called as the nose. What is the function of it? So, function of it providing an airway for respiration. It provides an airway for respiration, moistening and warming air, filtering in the inspired air, serving as a resonating center for speech, housing the olfactory receptor. You know the smell. Smell means the olfactory receptors are all present in the nose. So these are what you look, they are the functions of the nose. So providing an airway for respiration, moistening and warming air, filtering inspired air, serving as a resonating center for speech, housing the olfactory receptor. These are all the functions of the nose. Okay. Then we look into the next part. If you look, see what is happening now. If you look the nasal cavity, if you look the nasal cavity will extend from the nostril and continues as a nasopharynx has at coina. The nasal cavity, if you look, is divided into right and left half by a nasal septum. If you see, this is your nasal cavity, okay? This nasal cavity is divided into right and left by the presence of septa here. That septa is called as a nasal septum. Then, if you look the nasal cavity, it has got roof, floor, medial wall, and lateral wall. So, how do you see the building like wall? There, so it also consists of wall. Then, if you look, this is what you look, okay. So this is how the nasal cavity. So if we'll tell you this is the nasal cavity looking, that is divided by, this is the nasal septum which will divide the nasal cavity into right and the left half. So remember, the nasal cavity is divided right and left half by a septum called as a nasal septum. So this is the septum you're looking, that is called as the nasal septum. Allah. Okay, now next if you look, see here, this is a part you're looking that is called as a nasal septum. What do you mean? The medial wall of the nasal septum, if I tell, the medial wall of the the medial wall of the nasal cavity is called as nasal septum. So we look into it. What do you mean by nasal septum? The nasal septum forms a common medial wall of right and left nasal cavity. The nasal septum is usually deflected to one or the other side, rarely in median position. So if you look, this is the nasal septum you're looking. Okay, so this is a medial wall you're looking called as the nasal septum. The nasal septum consists of bony part, cartilaginous part, and fibrofatty tissue. So you see bones forming it, the cartilage forming it, and this is a part fibrofatty tissue. So first we look bones forming the nasal septum. The bones forming nasal septum are, one is perpendicular plate of ethmoid and one more is vomer. The bones forming nasal septum are perpendicular plate of ethmoid and vomer. The cartilaginous part is formed by the septal cartilage and one more called as septal process of inferior nasal concha. Okay, these are the forming it. Then, if you see, the anteriormost part of the nasal septum is made up of fibrofatty tissue and is mobile. This part is called as columella. You see columella. The anterior part, if you look, the anteriormost part of septum is made, if you see, they consist of fibrofatty tissue and is mobile. This is called as a columella. So, these are the parts of the nasal septum. If they ask a nasal septum, right, it consists of part called as, this is called a bony part, the cartilaginous part, and one more is fibrofatty tissue. The bony part is formed by perpendicular ethmoid and the vomer. The cartilaginous part is formed by septal cartilage, and the fibrofatty tissue present in front is called as a columella. See here. You can see the cartilage there, septal cartilage, nasal cartilage, and few minor ala cartilage, fibrofatty tissue in the lower part of the ala. So this is a hand-drawn diagram you are looking. Here you can see how the bones are present. Bony part, perpendicular to ethmoid, vomer, cartilaginous part is formed by septal cartilage, and this is a part called as the columella. These are the bones forming the nasal septum. Next, applied anatomy of it. Very important. If there is any ulcer or anything like that, if it burst open, there will be profuse bleeding in this region. Why? Why there is a profuse bleeding? You see, there are anastomosis of arteries present here. So if I divide it, you can see this is the nasal septum drawn. So then draw a dotted line and dotted line. So you can see this is the anterior part, this is a posterior part, this is the anterior inferior part. So anterior superior part is supplied by anterior ethmoidal artery. Posterior part is supplied by sphenopalatine artery. Posterior inferior part is supplied by superior labial artery. So this is the arterial anastomosis you see here. So you can see it is divided into. So you can see in the where in it is the area of in the anterior inferior part of nasal septum, you see there are anastomosis of all these vessels. They are called anterior ethmoidal artery, sphenopalatine artery, and the septal branch of superior labial artery. So you see anastomosis of all this vessel. So what will happen if there is, say, see, if I tell you Litter's area of epistatic, it is an area on the anterior inferior part of nasal septum, you see, which is highly vascular. See, you can see branches from facial artery, then comes from the sphenopalatine artery, and all this anastomas. So small ulcer affecting the area produces hemorrhage called as arterial hemorrhage. It will lead to a hemorrhage called as the arterial hemorrhage. This is about the applied anatomy of nasal septum. Okay, next we are looking into the next topic called as a lateral wall of the nose. This you are looking called as the lateral wall of the nose, otherwise called lateral wall of the nasal cavity. So the lateral wall of the nasal cavity is also formed by same. You see cartilage also, bones also, and the fibrofatty tissue present in it. So if I tell you what are the bones forming the lateral wall of the nose, you can see this is called as the lateral wall of the nose. So the lateral wall of the nose, the bones forming are called as the nasal bone. Then comes the next bone here. You can from before backward you go. In this way, if you go, you can see the bones forming. The bones forming are first bone you can see this bone that is called nasal bone. Then the next bone you are seeing that is called as a frontal process of the maxilla. The next bone is this one called as a lacrimal. Then comes the superior and the middle concha. Inferior concha is the independent bone. Then the perpendicular plate of palatine, and the last one is the medial pterygoid plate. So start from before backward. In this way, you can see the bones. These are the bones contributing in the formation of the lateral wall of the nose. So if I tell you the lateral wall is formed by nasal bone, frontal process maxilla, lacrimal, superior and the middle concha, inferior concha, perpendicular plate of palatine and medial pterygoid plate. These are the bones forming the lateral wall of the nose. So see here, all these are the bones forming the lateral wall of the nose. Okay. Now, what do you see within? When you see the lateral wall of the nose, so you can see here, this is the lateral wall of the nose, which is divided into parts. So the parts are one, you can see this part called as the vestibule, the next part is called atrium, the lastmost part you see the concave. Okay, so these are the parts. So what do you mean by vestibule? A small depressed area in the anterior part. This is a small depressed area in the anterior part. It is lined by modified skin, contains short, stiff, curved hair called vibrissae. You see the short, stiff hair in your nose. They are called as a vibrissae. Then you can see this part is called as the atrium. The atrium of the middle meatus is the middle part just in front of the middle meatus. Just in front of middle meatus, the part you see that is called as the middle atrium of the middle meatus. The last you see this part, this is called as concave. These are called as a concave. What do you mean by concave? Concave are irregular bony shelf in the posterior part. In the posterior part, you see the irregular shelf like they are called as a concaves. So these concave, the lateral wall present irregular bony projection called concave. Why they are present? They increase the surface area. So the concaves are three in number. They are called as superior concave, middle concave, and the inferior concaves. So these are the three concaves you are seeing: superior, middle, and the inferior concaves. Then below the concaves, if you open and see, you can see this part. They are called as a meatus. So you see the opening. What do you mean by meatus? Meatus is the passage beneath the overhanging concave. These meatus receive the opening of the paranasal sinus. So when you cut open and see, you can see opening here. They are called as a meatus. So you can see the meatus. So the first in the below the inferior concave is the inferior meatus. So you see the opening that is called opening of the nasolacrimal duct. Open in this. Next below the middle concha is a middle meatus which consists of ethmoidal bulla, which then ethmoidal bulla. So it consists of opening of middle ethmoidal air sinuses. Then the half mulek called as hiatus semilunaris, which consists of maxillary air sinus. The frontal part consists of anterior and the frontal air sinus, like anterior ethmoidal air sinus and the frontal sinus. The next, in the superior, you see, when you see this part, you see there is presence of posterior ethmoidal air sinus, and the uppermost supreme meatus, you see sphenoidal air sinuses. So these are all the openings you see in the lateral wall of the nose. Look again in this diagram, you can make clearly we have seen the concha. So below the concha you see the meatus. So first below the inferior concha is inferior meatus. It consists of opening of nasolacrimal duct. Next is the hiatus semilunaris, and here you can see this is the bulla, ethmoidal bulla, which consists of middle ethmoidal air sinus, hiatus semilunaris, which consists of see, maxillary sinus posterior, anterior frontal are present in front. Then superior meatus, you see one called a mid posterior ethmoidal air sinus. Supreme, you see a recess called as sphenoethmoidal recess. It is called sphenoidal, where you see the opening of the sphenoidal air sinus. See, all the air sinus are opening in the lateral wall of the nose. See, this is the same inferior meatus, nasolacrimal duct, middle meatus, maxillary sinus, frontal sinus, anterior ethmoidal sinus, supreme meatus, posterior ethmoidal sinus, sphenoethmoidal recess is the sphenoidal air sinuses. So you can see in the what we have discussed till now. Okay, then comes to the blood supply, that is from the artery, you see, that is called maxillary artery. So blood supply, that is called dorsal nasal artery, angular artery, superior labial artery. Internal nose part is supplied by sphenopalatine artery, anterior and posterior ethmoidal branch of ophthalmic, and branches from facial artery. Then come veins. When you see artery, there is venous drainage also, ethmoidal vein, other branches from pterygoid venous plexuses and facial vein. These are, see, this is the main artery supplying it, that is called as a maxillary artery, which is the main artery supplying to this region. Then after this we look into the next part, which is called as a paranasal air sinuses. So in the skull bone, you see the skull is made light. You see the skull is made light because of the presence of cavity in them. So this cavity makes the skull bone lighter. So these cavities are called as a sinuses. They are called as a paranasal air sinuses. So if I tell you what do you mean by paranasal air sinuses? These are air-filled spaces lined by mucous membrane and communicate with the nasal cavity. They help in conditioning the inspired air by giving additional surface area. They reduce the weight of the skull. They also add resonance to the voice. Okay, so if you look, see here, paranasal air sinus means cavities in the cranial bone. In your skull bone, there are cavities. Okay, what they do, what are the function? First, they lighten the skull bone. They lighten the skull, produces mucus. Resonant, your voice. If you see in the normal and in cold, in normal, how the voice will be when you get cold, will be difference in voice. Okay, so resonant during sound production, and when you inspire the air, it get warmed up by help warm and moistening the air. So all these are done by the presence of paranasal air sinuses. So see here, each sinus is named after the bone it reside in. So where it reside, where it is present, so they are named according to them. So look, in the frontal bone, the sinus is called frontal air sinus. In the maxillar bone, the sinus present is called as maxillary air sinus. Next two are ethmoidal and sphenoidal air sinus. These are the paranasal air sinus. So names are frontal, maxillary, ethmoidal and the sphenoidal. These are the air sinuses. They are called as a paranasal air sinuses. Okay, so what are the paranasal air sinus name? Maxillary air sinus, ethmoidal air sinus, sphenoidal air sinus and the frontal air sinus. So remember all these sinuses. So, so a brief summary of today's class. We have looked about the parts of the respiratory system. So know what are the parts of the respiratory system. Then we have looked into the medial wall of the nasal septum, which we have looked. Then learn about the nasal septum, about like bones forming it and the blood supply of it. Then we have looked about the lateral wall of the nose, which consists of the concus, which consists of opening called as a meatus, where you see opening of the all these sinuses opening into them. This is about today's class. Thank you.